Welcome to the Undiscovered Gems podcast, hosted by NBA legend and business powerhouse Charles D. Smith, highlighting today's best and brightest business minds.
And welcome to Undiscovered Gems. I'm Charles D. Smith, the host of the show, and today we have Charles Donahue. Mr. Donahue here has spent 57 years of his career in healthcare. And we know healthcare is a big problem in this country. Not everyone has it, but everyone needs it. And Charles has spent his career in community-based healthcare planning. And we're going to talk about that today because it's so useful and so needed in today's society. Charles, welcome to the show.
Thank you very much, Charles. Happy to be with you.
Great, great. Charles, let's open up and just kind of tell the audience a little bit about your background.
Well, I started off at Brown University, and I became interested in pre-med, taking a lot of science courses. The problem with that was I was an ice hockey player, and I had to get out to hockey practices, so I missed a lot of labs. And you had hockey games Wednesday nights, far away. You get back about 8 in the morning on Thursday, so you miss it. So it was always a challenge. Graduating, I was on the waiting list at a medical school. I get into law school, and then I was accepted in the Peace Corps. And my father, I was very, very proud of him. He was in the South Pacific in 8 sea battles, torpedoed twice, and I always had an admiration for veterans who served at that time. Then President Kennedy started talking about not what the country can do for you, but what you can do for the country. And I said, I can always go to law school or medical, but why don't I go into the Peace Corps? So I spent 2 years in Malaysia working in tuberculosis control in a very rural area. And I came back maybe wanting to get into international health. So I applied to Cornell University. They had a great program in Southeast Asian studies, but they also had a fellowship program. When the federal government implemented Medicare and Medicaid, they said we need to have health planning, community groups, consumers getting involved in making choices, not just experts. There were some models of this. Finger Lakes in upstate New York, for example, had been doing this for many years with some hospitals, but they got the community involved. So this was the model in the mid-60s, community health planning. So I spent 4 years at Cornell, taking all the coursework for a PhD to get into this field called health planning. And at Cornell, I did studies of my own. I went to Europe to say, why do we rank 21st in infant mortality in the world? And they spend a lot less money. So I studied that at Cornell, did some research, got some data, and published my first paper in the Journal of Obstetrics and Gynecology, which later became used by teaching hospitals in Boston to identify high-risk women who needed to get in early for prenatal care. Doesn't matter if you have health insurance if you don't come in early, because if you have diabetes or high blood pressure or other problems, a lot of maternal deaths and infant deaths could be prevented. So I became very interested in this field. Got my first job in Boston with a group called the Health Planning Council for Greater Boston. And I was out Monday through Thursday nights in the Boston neighborhoods with local committees identifying what health problems they had, what they wanted to do. At that time, most parts of the United States, cities had family practitioners in the neighborhoods. Suddenly they got old, they retired, and the young doctors want to be specialists, and they went to the suburbs where there was health insurance. So in the city of Boston at that time, everybody rallied to get a neighborhood health center where the local community would hire doctors, fire doctors. So I worked quite a few years in that area where once Boston had the greatest number of community health centers in the country. The idea started, and it's now everywhere in rural areas, in urban areas, where neighborhoods get together, they become the board of directors. And it's a lot of time spent helping to organize that, helping to identify databases in Massachusetts that could be used, educating other planning agencies. And I ran the Health Planning Council for Greater Boston for 8 years, where our consumer group would offer opinions to the state on, do we need MRIs? Do we need heart transplants? How many do we need? We did work with the unions and the businesses on health insurance cost containment. How do you contain health costs without cutting benefits? We also developed a database that allowed us to go to physician groups to get them to study variations in hospital use. Every city and town in Massachusetts,
Let me
every neighborhood of
interject for a
Boston,
second.
we identified.
You mentioned something very important. On the community groups, Charles, is there different information from different communities that you use in the same way?
We did one study where we looked at adequacy of prenatal care, for example, where if a woman had
Hmm.
10 visits and if she had began in her first trimester, that was considered adequate. What what we looked at then, every city and town in Massachusetts, and every neighborhood in Boston. What we found out was the rich towns, the rich communities where health insurance was available, women had 80, 90% adequate prenatal care. The city of Boston, 40%, except in the few neighborhoods that had neighborhood health centers. They had gone from 40 to 80%. So that data that we developed as a consumer group went to the Boston City Council, who was leery. They didn't know what these health centers meant. Their storefront, idealistic doctors. That data
Sure.
convinced them to put city money into developing neighborhood health centers. So every neighborhood in Boston has health centers for immigrants. There's one health center in Boston for Haitians. There's health centers for
Mm,
the Koreans, for the Vietnamese, for the Irish, the Italians. All of these health centers, which is valuable when COVID or something happens. You got people in your culture, in your language, appreciating you to convince you. So because you got Massachusetts has one of the lowest health insurance rates in the country. The most people who are insured in healthcare are in Massachusetts right now because of a lot of work by these community groups. And Mitt Romney, who in Massachusetts was rare, he's a Republican politician. He comes in and the business community said, do something about health costs. He did with the community groups, and with Ted Kennedy came up with a health plan, which became the Affordable Health Care Plan in the United States now. So that
mm.
came out of Boston neighborhoods. Ideas, suggestions, what can we do? What's not the perfect plan, but the better plan. But this adequacy of prenatal care is one example of how a community group provided data that changed the health system. And the people, the doctors that set up the first neighborhood health center in the Mississippi Delta and in Boston, that became the national model for urban healthcare and rural healthcare. But the community people got into it, supported it, and did it. And the
But
community local retirees, they learned how to Robert's Rules of Order, how to run a meeting, who's the president, how do you get money to get these health centers going. So it's the backbone of the health system right now in most of the country.
Charles, you've spent 57 years in this community-based planning. I have to ask a very tough question, and I know you can take it in a lot of different questions. Why is it that we do not have health care for everyone in this country? And I travel abroad. You mentioned Malaysia. I've spent time in Kuala Lumpur, Malaysia. Uh, why is that? And I'll give you an example. I took a group of former basketball players to Taiwan, and one of the guys had a really bad toothache and needed surgery. When he knew we were going to Taiwan, he dealt with it. It was painful. I said, "Why don't you get it done before he goes?" He's like, "No, I'll wait till I get there." When he got to the hotel, he went around the corner. He got the tooth taken care of, got it extracted, and it all cost $30. $30. In the US, it'll cost him a couple thousand of dollars without insurance. Why is that gap like that in the US?
Well, it's I spent one summer when I was in graduate school in Europe trying to understand why do they have low infant mortality. And the bottom line was everybody was insured. Okay. Then I went to England
Uh,
where they found out this up in Aberdeen, Scotland. They had the lowest infant mortality rate with the highest risk women in Great Britain. So I went there and I said to the chief of obstetrics, how did this happen? He said the sociology department helped us out. We asked them to gather data on who the high risk women are to get them in for care early. So it's not just insurance, but it's get women to come forward early in prenatal care to get care. That's the secret. So the bottom line was when I worked in Massachusetts, in this area, with the data I just told you about, how we proved the health centers could get, with the culture of the women, they could speak their languages, they could convince women to come in early for the prenatal care. That's the cruel thing. Now, a part of the Romney Care in Massachusetts plan, they came up with different ideas. Rich people who don't have health insurance because they don't have a company, when they get seriously sick, they don't pay for their health care. They stiff the hospital. And Romney said that's basically rich people who are basically selfish. Massachusetts had a law that said, rich, if your income's about a certain area, you got to have health insurance. We'll tax you. That was accepted in Massachusetts, but other parts of the country, allowing the rich people who don't have health insurance, don't pay. That goes into the rates everybody pays. Everybody pays the insurance for these hospitals, get reimbursed by the insurance companies when they set their rates. They cover all of the uninsured people who are rich. Then they said there's a lot
Right.
of middle class people who need some help. We subsidize them, but the poor is what's important. Massachusetts expanded Medicaid so that no matter what your income was, everybody was eligible. It might cost $9,000 a year for prevention services. However, that would prevent the $500,000 intensive care baby that could have been prevented. Now, there's 12
Sure.
states in the United States today that have not expanded Medicaid. They've decided not to do it. It has a lot of politics in it. They can tell you, you look at the infant mortality by state, maternal mortality by state, there are some states in the United States with infant mortality rates, maternal mortality higher than developing
Mm.
countries. And most of them are where they did not expand Medicaid. Now, the federal government pays 90% of the expansion. So they're just not allowing women. So right now, it's not a problem everywhere in the United States. The lowest uninsured rate in the country is Massachusetts, and we're proud of that. But it was all community groups and Mitt Romney coming in with some smart ideas that changed that. But there's still parts of the country that have taken what the Obamacare, which became the Affordable Care Act, that has a lot of great potential if they get people involved in expanding Medicaid and then educating people. If you're
Hmm.
covered by Medicaid, you got to come in for prenatal care. It's not the insurance only; it's the education and telling people how important this is. So pregnant women immediately are fully informed of where they should go, and they're happy to go there. So those are some of the things that could change nationally,
Right.
but we learned a lot in Massachusetts from community groups.
So would you say, Charles, that it's about the gathering of the data, using the data for the community-based planning, and then the end result comes down to pre pre-care, prenatal care, and really that is across the board, would you say, for all illnesses and it's prevention. It's all about that data and prevention. Would you agree?
Absolutely. There's so much hospital care today that is preventable. A lot of cancers, the heart, all of that, if you found it early and treated people, you could be saving a fortune in hospital care that's unnecessary, just as prenatal care has a big impact on reducing maternal mortality, infant mortality.
Hmm. If you talk a little bit about in your career, 57 years, hey, Charles, that's a long time for anyone. Are you retired today? It seems like with your energy, you're still at it, but are you retired?
I'm teaching at the Boston University School of Public Health, where they have an
Okay.
activist lab. It's not just kids that want to get a job, but they want to change things. And they identified in my career I was somewhat of a troublemaker wanting to change the system. So if people are happy with the way it is, they don't want to change. So I'm teaching courses there right now in what I did in infant mortality, what I did in global health in Malaysia, and what I did in health planning, organizing groups, getting consumer groups together, and getting them to work hard to educate politicians and others. We developed a database as a consumer group, and we published 8 articles in the Journal of Obstetrics and Gynecology, the Academy of Pediatrics Journal, in the the Journal for Obstetrics and Gynecology. So as a consumer group, we developed a database, and we went to physician groups who never studied epidemiology. That's the science of data and what data tells you. Eventually, the Academy of Pediatrics, the College of Surgeons, and the OB or the pediatric groups worked with us. We published articles with them, and they took our data. We worked with them. We took it to hospitals. We took it to physician groups, and our questions were, for example, are these high rates of hysterectomies good? Should everybody have more hysterectomies, or are they the unnecessary hysterectomies? Are the low rates of hip replacements in urban areas where there's a lot of low-income old people, where there should be 100 hip replacements and you only had 10, is that a lack of access to orthopedic people? So after working for 6 years as a consumer group with the College of Surgeons in Massachusetts, the chief guy said to me, Charlie, you came to us, you're a consumer group. You had already published an article in the Journal of the American Medical Association. They said doctors should work with you people. But you're a consumer group. We don't have any control over you. Why should we work with you?
Right.
But we're glad we decided to work with you and publish articles with you in our professional journals. But the method you have to define as fist. Velvet. We knew you were going to do it. We knew you were going to do it. Decided to join you. Decided to join you. But this is what a consumer group works hard. That works hard. Change the health system. To change the health system. Educate the doctors, the hospitals. Educate the hospitals. That database went out to all the hospitals. Went out to all the hospitals that had high rates. A couple of hospitals I know of. Where I went physician groups. Spoke to the physician groups. They called me a year later. They called me a year later. We had a high hysterectomy. We had a high hysterectomy rate. Quite a bit down now. Quite a bit down now. We required doctors to have certain features in our hospital. So we did as a consumer group. Began to cut costs. That's in addition to work we did with unions and businesses. How do we cut health insurance costs without cutting benefits?
So let's take a step back. I can see that you're not retired because you're coming more toward me. You're coming more toward me. I think that you're going to think that you're going to change places. We're going to change places. So stay back so we can see your face. So Charles, look, 57 years is a long time. We all go through some things that kind of shapes us. That kind of shapes where we are today. To where we are today. Talk to us about your toughest obstacle through your career that you overcame. And then it was a good lesson for you to move forward.
Well, dealing with a lot of the hospitals that had ideas of, for example, at one time, 4 hospitals in Boston wanted to start heart transplant programs all at the same time. And we thought, Boston had the first kidney transplants in the world in the 50s. So, but the other hospitals that got started in other parts of the country. So we contacted all the hospitals around the country and said to them that we're doing heart transplant. What would you reckon? Start 4 hospitals doing it. And they all came back and said, we'd recommend one hospital, build up the business, and then when you get a lot, go to the second. Because the heart transplant, the surgery is a piece of cake. It's having trained staff at 2 a.m. to find a tissue rejection that jump on that because they've seen enough patients.
Sure.
So that was our recommendation as a consumer group to the state. Because of political power and the power of teaching hospitals anyway, their boards of directors are all connected people. They jammed it through. They got 4 hospitals all at once. A year later, one hospital, instead of 5% mortality, had 50%. We were right. But that was, didn't follow our advice. So you have disappointments like that when power overcomes you that turns out to be not too smart. So we had a number of instances there. And at the end, Massachusetts legislature pulled money from supporting the agency I ran, the Health Planning Council of Greater Boston, because of an opinion we had on a hospital that went to the suburbs, wanted to put a lot of teaching hospital type of beds, expensive. And we said, work with the local hospitals, the community hospitals, work with them. You don't need new beds. They got to the political people. The political people cut our funding. I had to find money to lay off people. And that was the end of my health planning career before I set up my own company with a friend to deal with the same issues, but as a nonprofit corporation.
Right. So it forced you to set up a your own business that turned out to be very successful. You hear different stories like that of going through crisis, and then on the other side is a big achievement. Um, you know, through your career, there had to be, you've had to have mentors as well. You probably mentored a lot of kids along the way. However, who were your mentors? Who gave you that inspiration and that knowledge for you to launch into your career space?
Well, I was fortunate to have quite a few. I met a guy when I was in Malaysia who was hired by the University of Massachusetts as their first director of a new medical school. We had three already in Massachusetts, and there's a lot of opposition. Why do we need another medical school? Well, we're going to train family practitioners. That was new. All these other medical schools are training specialists. The fellow they hired was from Kentucky, and they had one of the few medical schools with the Department of Family Medicine in the medical school. Massachusetts was late getting the building going. He joined the Peace Corps to take care of us. A lot of us Peace Corps people got malaria and diseases. So I met him there, got to know him, and he came back. He came to Boston, and I was on his board of directors, and he was on mine. But he had the largest preventive medicine residency program in the United States, training doctors to go in as family practitioners and change the health system. He was a dear friend and a mentor. But I just finished a paper for the School of Public Health at BU where I identified 15 people in my career that made huge differences, many of them physicians, stepping out of just being a physician, but wanting to change the health system. An example is Mitt Romney, who I mentioned earlier, who came
Right.
in and didn't want to touch healthcare, but he made a huge difference. Another doctor I worked with, he's a cardiologist, and he worked with a lot of our union groups, cut health costs by improving their health, their diets. Uh, he trained a group of operating engineers that we worked with and steel workers who were working at the Children's Hospital in Boston, next door to where all the kids were being treated in a cancer hospital. And these steel workers are up there 20 stories up, looking out the window, and the little kids are waving to them. Next, they see names in the window: Brenda, Peter, Harry, the kids' names. They leant over the steel and put the names of the kids on the steel, thrilling the kids. They were going to be immortalized. They go down to have lunch at the Roach Coach. This was a van that came in with hot dogs and hamburgers and all this. So they say to the people at the Roach Coach, "Do you have preservatives in these sandwiches?" And of course, they said, "Yeah, that's how you get sandwiches, preservatives."
Roach
Our,
coach.
our cardiologist, Dr. Evans, told us those aren't good for our health. Can you make us fresh sandwiches with tuna fish and chicken salad? Well, we'll do it. It's a little more money. So the next few days, there's out there at the Roach Coach are the all the union guys and the doctors and the nurses from the hospitals. So the doctors and nurses see the union guys are getting special sandwiches from the side. They say, "What are these guys eating?" He says their cardiologist told them these preservatives are unhealthy. That's what you guys have. We've made sandwiches for them with fresh tuna fish. Fresh. Well, what do you give this to us? So anyway, the doctors demanded to have the non-preservatives also. So that's another
Right.
guy who I respect greatly for the way he could explain to union members and others how to improve their health care, get exercise, eat the proper foods to maybe make them live longer and have fewer health costs. So I've got about
Right.
15 people like that inspired me to keep plugging away at things.
Right. Sometimes when you answer questions, you get into it and you come too close to the camera and we can't see your whole face. So kind of try
Right
to
now,
sit back.
I can't see. There's nothing in the camera. I can't see anything right now.
Yeah, you're perfect right now. There and further back, you'll be great. So during your career, if you look back at it, what would be something significant with all the knowledge you have now that you would change?
Well, to be honest with you, I wouldn't change anything. I'm very happy. I feel very lucky. Sometimes you make your breaks, but I'm very happy that I decided to. If I, I'm happy I didn't get into medical school. I've had much more fun changing things than if I'd become a physician. But I'm not. There's nothing I'd want to replace, quite frankly.
And what about the system? What about what you see out there in healthcare?
Well, I uh, through the School of Public Health at BU and my lectures, I'm trying to educate kids and physicians at the medical school at Boston University, the medical schools at Boston, to get these people to realize what are the tools. Data can be very helpful. Data can be very powerful. How do you begin to change things that need to be changed? And even though
Mhm.
Massachusetts has great results in infant mortality, maternal mortality, there's still a lot of improvement that we can make. And when you make a change, sometimes it has an impact on the rest of the country. People are
Sure.
looking elsewhere for ideas.
Nice, nice. And so, with the work that you're doing now, you mentioned various publications. What were some of the accomplishments you've had in your career that you're most proud of?
Well, I was recognized by the American Public Health Association and the American Health Planning Association for the work my health planning agency and I did. It was a national recognition by those two national organizations with the Community Service Award, named after the director of that Finger Lakes Health Planning Agency up in Rochester, New York. The Massachusetts League of Community Health Centers, of all the health centers in Massachusetts, they gave me an award, a community service award, for the work we did in health planning to support the development of neighborhood health centers and the maintenance of neighborhood health centers and helping them with their issues. Those are two awards I received that is recognized because of the national groups as well as the local groups that we work so hard in Massachusetts, the community health centers.
And you should be very proud of those. That's a testament to the body of your work over your career. If you can say one comment to the audience based on your career, health insurance, prevention, what would you tell the audience moving forward in their lives?
Well, probably one of the things that I learned the most, and I had a father who I respected greatly. He was a lawyer in Boston, very successful lawyer. And he took me in. I used to go in and see Red Sox games. He'd take me in at lunch, and he took me up the elevator to his office. And in those days, they had a person running the elevator. This is a black gentleman who ran the elevator. And on the way up in the elevator, my father told me about every one of his kids. Who was a softball? Who was a shortstop? What is buddy? So this elevator operator is so proud that this lawyer spent time to know about him and his family and was his friend. And I had
Mm,
struck me as a young kid what a wonderful person my father, Navy veteran, HC battles, how he showed respect to other people. So
mm,
ultimately, if you want to change things, the most important word is empathy. You got to understand who you're changing, who you want to, why, how do they understand the issue you're dealing with? What do they know about it? Why they want to change or don't want to change? That started in Malaysia, working with rural, isolated villages. It worked with neighborhoods in Boston.
sure.
But what is important to them? What do they are willing to change? And learning about reaching out to other people and understanding what their values are, what's important to them, what they see about change. That's probably the most important thing you can develop in your career.
And you know what, Charles? That's the most important thing that people can develop in their lives in any career that you have. You nailed it on the very last question, which is to be empathetic. Your success is based on how you can educate, feel, and understand the people that you're working with. Awesome. Charles, our time has come to a close. Your career, 57 years, concentrated in one specific area. Your knowledge is unmatched. This is really what Undiscovered Gems is all about. Charles, thank you for being on the show, providing your wisdom, your insights to the audience here at Undiscovered Gems. Thank you so much.
My pleasure, Charles. Very nice talking with you.
All right. Hope to talk to you again one day. Charles,
Take
be
care.
well. All right.
My pleasure. Thank you.
We hope you enjoyed this episode of Undiscovered Gems with our host, Charles D. Smith, highlighting today's best and brightest business minds. Brought to you by Pods Entertainment Group.